All right, hey, Mindy, let's give a little lead in here to the people, the three or four people like Karan and Rebecca and Crystal and the folks who might look at this one of these days.
The fan,
We're taking our huh?
the fan.
What? The fan. That's right. We're taking we're taking our shot at what we're calling our podcast. We're calling it Now That I Know, and the whole point of this podcast is to talk about a husband and a wife team who sat 20 feet from each other for 6 years before we realized that we were doing much of the same work, many of the same things, just in different places. And so we've had several people who said you two should do a podcast. So we're going to give that a shot and see if anybody gets anything out of it, anybody listens. You know, the whole name of Now That I Know comes from a story Mindy told me coming back from work one day back before COVID, where she had a team member of hers that was learning on the fly how to work in the office. She was getting into people's drawers or she was leaving early because she thought her work was done. And every time Mindy, as her leader, would counsel her and tell her that's not how these things work, she'd say, "Oh, well, now that I know." And so that to me, that always made me laugh, Mindy, when you told me that story.
Yeah.
And I feel like that whole title applies to you and me as well. Now that we know
Mhm.
what the other person is doing, whether it's our jobs, our customers, ourselves. We sit close and yet we're separated all the time. And so this whole podcast is just us at any given time talking about the jobs, our relationship, our customers, us, ourselves, and just some kind of hopefully something that makes sense for anybody but us. We think that there's a need out there for people to be real and to share how they got to where they are, let's say in business, but show that human side or the cat side as she walks
Yeah.
behind you. You may want out. But so before we go any further, would you like to add anything to the first few minutes of the first podcast?
Nope, I think that that pretty much covers it. I mean, we like you said, we've been sitting across from each other, literally I can open my door and we can chat for years. We've been doing this because we've both been the cat figured out how to open the door by herself. We've been working, both of us have been working remotely for a long time, doing a lot of the same things and not realizing it and trying to lead teams of people who, were a little bit unclear sometimes on what their role was, and now that I know really plays into that because there's a lot of things people don't know or don't understand that we as and I'm going to play the Gen X card. We as Gen Xers, we grew up just kind of learning on the fly and having to pick up on our own and sort of just inherently knew it was just that kind of implied knowledge, right? And these the some of the younger kids, I shouldn't call them kids, they're adults, but some of the younger generations are coming in and they didn't have that, hey, learn on the fly feral upbringing that we had. And so there's
Right,
things
right.
that they just don't know. And our job as leaders is to instill that knowledge in them so that they can be successful and they can go out there and understand that, these are things that you just have to understand in the workplace and things that will help you be successful at doing your job.
That's it. And maybe relationships like we're such
Yeah.
models for any of that.
Oh, yeah. I mean,
So I think what I'd like to do, and what folks don't see is behind the scenes, how long it took us to get prepared just to get to this place where the microphones worked and we knew what we were going to attempt to say and all that. So I've got some notes here over on the side. I just want to kind of we'll follow just some beats as I've heard someone call it once, just to kind of lay out who you are, how you got to where you are,
mhm.
and we'll flip that script around for episode two, and then we can talk about maybe in three or four the us aspect of this. But so I'm going to just start with you, among many other things, are an entrepreneur. You've got a business that you've stood up. You are in what we like to call that pre-revenue phase,
Yeah.
meaning meaning we're paying for it. So what I want to do is I want to ask you, and I'm going to sort of take you through the journey, if you will, in a way that kind of helps you frame it, maybe, and helps other people get a sense of who you are and why you're doing this. So give them a quick who are you in the context of, hey, this business that you started,
Mhm.
and then tell us why you built. revenue optimization and intelligence, if you will.
Sure. Sure.
Yeah, so we'll start with that.
Okay. So I have been working in revenue cycle for healthcare for almost 15 years. In healthcare for much longer than that, but in the back office doing revenue cycle for almost 15 years. And I have spent many, many long nights trying to figure out how to pull together data in a way that was digestible for executives and other senior leaders through systems that were just not built to give me that information. You know, you're working through your EHRs that have canned reports, and that raw data is so inaccessible. And the canned reports are not always what you want. They're not rolling up the data in ways that you want. And I would spend hours at month end trying, days even at month end, trying to pull this data into reports that were actually useful. And there were times when I was in the office at midnight, eating cold pizza and drinking cold coffee, trying to actually get through month end to have it delivered by the right date. You know, we'd have to have that reported up by the third, and I'm struggling. And so,
Let me ask you this.
sure.
Well, let me ask you this. How many so you are just this is just one story, and I don't mean
Mhm.
to cut you off too soon, but I wanna kinda
Mhm.
have folks get a sense of the scale of this.
Mhm.
This revenue cycle
Mhm.
management aspect that you're talking about. Anybody in a corporate setting who is responsible for the numbers has pain like this.
Mhm.
Help me get a sense of just how many people you're talking about and the scope of this, right? Even just in the healthcare vertical, let's call it,
Mhm.
right? You're talking tens of thousands of people,
Sure.
hundreds of thousands.
Sure.
How big is right?
You
Okay.
know,
And how many
I can't really give you a
yeah,
number. It's a lot. Anybody who's working in healthcare that is responsible for that revenue cycle piece is dealing with this. So you're dealing with revenue falling through gaps, you're dealing with leakage, you're dealing with all of these denials that are coming in and you don't know what to do with them or what they really even are because you can't actually access the data. You're getting this canned information that says, "Hey, this is your number," but you can't really see what's behind the number, and it's exhausting and it's frustrating. And then a lot of times you're dealing with an outsourced, even an offshore billing team that's handing you a report every month, and they're saying, "Hey, your revenue looks good. Your days in AR is, 38 days." And you're like, "Well, last month it was 36. Shouldn't it still be 36?" And they have an
getting better.
explanation, but the explanation kind of is not really something that resonates with you, but you can't really get
Well, let's
at why.
right. I wanna jump in on that.
Mhm, please.
And keep in mind that at the end of this, when we put this out for public consumption,
Mhm,
we're going to provide links
sure,
to your website called
absolutely.
ROI that
ROI that
works,
work.
right? Where you have put this concept into action to help people, give them tools and means and education to solve those problems that you touched on just a bit there.
Mhm,
So what we won't do is try to really deep dive too much
absolutely.
into the functionality of it, but I want I wanted people to kind of get a sense of, hey, this human being on the other end
Mhm,
for years and years worked late hours,
mhm,
and the problems themselves didn't really change.
mhm.
It's just you struggled through
Yeah,
every month
right.
or every quarter for several years
Yeah,
in a row, like you're stuck in a loop. And that had impact on our
it
marriage, if
did,
you will, right? This kind of
it
goes
did.
back
I
into,
missed
hey, now that
birthdays, anniversaries.
yeah, now that I know, and the funny thing is I'm sitting, whether this is pre-COVID, you're in
Mhm,
the office and I'm in my office, and we're dealing with again some of the same kinds of problems in that operational,
mhm,
space or spaces. And the other person didn't really understand or know what the details were.
mhm,
We just knew that that person didn't show up or was late or
mhm,
didn't answer the phone or
mhm.
came home frustrated or
Yeah,
whatever. Right. And so it took us way too long to ask just enough about each other without
mhm.
our eyes rolling in the backs of our heads
Yeah,
to to get around that. Right.
right.
So what I want to kind of have you do is build on that idea that you've got that pain that that tens of thousands of other people who have anything to do with revenue cycle management experience one way or the other. They've got tools or they don't, or these tools don't
Mhm.
mesh or whatever.
Mhm.
In the healthcare arena where you operate most,
Mhm.
right? What are the top 3 pain points that ROI that works would help them solve? So it's one thing to say, "Look, I'm working all these hours,
Mhm.
these reports are hard."
Mhm.
Give me 3
Mhm.
things that, like, this thing
Sure.
solves, so, like, and it gets them back, I don't know, how many hours per week,
Sure.
you know?
So hours, I mean, you probably could save a whole person if you're using it appropriately. So if you have a person who's been dedicated to chasing all of this revenue, this person could be reallocated to something that's actually more a better revenue generator instead of just chasing after low hanging fruit. So as far as hours go, I would say one FTE. So my goal with ROI is to give you back that time. And the way that we do it is fun. Instead of wondering and guessing at your denials and filing appeal after appeal after appeal that get you nowhere, um, I'm providing you with denial tools. So each denial reason has a path. So they all tell a story. We have a system of it's our EDI intelligence lab. So you can go in there and you can look up any of those denial reasons, and it's going to tell you what the likely causes are, give you an action plan, appeal tips, prevention strategies. So what you've got there are not just how to do the appeal, but you've got a workflow plan. So you can build a process for going forward to try to build that out so that the next time that happens, you have an if this, then this scenario already built so that you're not chasing
Okay,
that
right.
appeal over and over and over again, doing the wrong thing. Or if it's a situation where that adjustment code that you got actually doesn't need an appeal, you don't have a billing team filing a useless appeal. They're putting in a corrected claim and doing it the right way so that it's not then coming back again as a duplicate. So, number
Gotcha.
1, we're
Number 2.
so number 1, you've got an appeal strategy where you can develop a workflow. Number 2, along with that, you're not just guessing at your template, your appeals and what you're gonna say. If you're gonna write an appeal, I have templates that are already loaded into the system. You're gonna download that template, you're just gonna fill in your information. Okay. You're going to plug in your practice information. You're going to plug in your provider information, and you're going to plug in any of the clinical details that are appropriate, any policy information that's appropriate, whatever applies. So you've got strategies that go with that appeal. So you've got your appeals, you've got your appeal templates. Then behind all of that, anybody who needs it, I've got automation modules that you can license for your practice that helps you put in workflows and automation to run all of that behind the scenes for you and roll up into a whole command engine where you've got an eye on all of that data and everything that's coming in and out. So it starts at the beginning with standardizing all of your data coming in and out. So if you've got multiple systems, let's just say you have practices that are on different EHRs, or you've got an EHR system, you've got a practice management system, you've got a CRM. We can take all of that data and roll it up into a standardized data warehouse. So when you extract reports, all of those field names are the same. The information is rolled up into one standardized data format, right? So you're not,
Let me see if I can yeah, let me see if I can understand that. I wanna stop you for
please.
just a second to make sure I understand the power of what you just described, right? So the first pain point you described was, hey, on the individual level, you've got, let's call her a revenue cycle manager, him
Mhm.
a revenue cycle director, or
Mhm.
whatever the
Sure.
person's title is. They are sitting down, navigating month end,
Mhm.
trying to get this information
Mhm.
in, or in this case, you were talking about them trying to get revenue
Mhm.
recognized, never mind reporting.
Right.
They are there trying to get the dollars for their provider for the services that were provided, right? $57 here, $5,000 there,
Mhm.
it all adds up,
Mhm.
right? It gets stuck in increasing numbers of account receivable days and all
Mhm.
that, right? So what I heard was there's that single point or, team point of benefit. And then you pivoted in number 2, the pain point of getting into that larger ecosystem of where it really helps for reporting,
Right.
where the data can all be in one place.
Mhm.
That repeatable, reusable aspect is now writ large for the practice. And that is where that reporting value prop comes in, right? Because now you're tied to CRM, EHR,
Mhm.
ERP, whatever systems you have to tie to for your practice, right? And that's a small practice, a medium practice. I think where you are trying to solve and stop me if I'm wrong, you're trying to solve the pain points for those small single practices, the smaller group practices, things like that, because the
Mhm.
larger ones tied to hospitals, they've got different systems and different enterprises of
Mhm.
scale
Mhm.
where, at least at the moment, this version of the tool doesn't play in that space, but not to say that we won't at some point.
Yeah, now I will say this, it absolutely can play in that space. That's not really my target right now. My biggest goal is to help those smaller practices that are dealing with this and they just don't have the resources to be able to get those enterprise level tools that some of those bigger groups do. However, if there's an
At a
enterprise group
cost.
that doesn't have that, we absolutely can help them because these automation modules are above and beyond anything that you would have from your standard EHR. They go way beyond what they'll
Yeah.
do.
Yeah. One thing, what I don't want to do is, again, get into a thing where I'm trying to sell the details of the thing. But the idea is that this tool is the price points and the entry points are cheap enough for these small and medium practices where their per month or per year fees are low enough that those, and I've seen these, the $57 denials or the
Mhm.
$157 denials. This thing pays for itself in a couple of weeks, even with those
Absolutely.
smaller dollar
Absolutely.
amounts from what I've seen when you and I talked about it.
Yep.
So you've talked about the pain point on like that single individual level where she's
Mhm.
working till midnight at least once a month, if not
Right.
every quarter forever, right? You talked about the
Right.
aspect of solving the pain point in one level up at the practice level, let's say, right? So what's that third pain point that ICP, that person you were her, you're trying to make her life
Mhm.
easier, give her some time back so she can go spend time with her family, whatnot, or her hobbies,
Mhm.
anything but this,
Mhm.
right? What's
Yep.
that third
Yep.
thing that you do for that person?
Okay, so we talked about the denials bringing that revenue in.
Yeah,
We
what is
talked
the
about,
third thing? We talked about two.
the Yes, I'm
Yeah.
trying to remember where we went. We talked about that. We talked about standardizing all the data. Again, the automation modules are going to give you everything
Right.
you need from beginning to end. So all of that's there. I have within the tool the ability for you to build. So this is number 3. So number 3, most of us don't know when we're going in, especially when we're going into a new, let's just say we've taken a new job. We're a new revenue cycle director. We're going in. We don't know what the pain points of this practice are. We don't know where the leakage is. We don't know where the gaps are. I have a 90-day action plan. So this plan starts with a revenue integrity master audit. You go in and you do that master audit. It's 100 checkpoints. It starts at the beginning from check-in all the way to the very end of the revenue cycle process where all those denials and appeals are coming in. So it goes from beginning to end and checks goes through all of the things that you would do from the first time that patient comes in and all of those checkpoints and identifies gaps. And then from there, you complete this 90-day action plan. And this 90-day action plan, what it does is it tells you days 0 through 30, 31 through 60, and 61 through 90, what your process is to build a scalable workflow to clean up and maintain that RCM process so that from the minute you walk in until that 90th day you're there, you've built a sustainable model and you can clean everything up and you can get it to where it's workable going forward and close those gaps.
I like the sound of that. Let me ask you, as if I had any experience as an RCM professional. My question will be based on as if that were true. You talked about the system, that audit system that goes through those 100 points.
Mhm.
What is the what is the burden on me as the user to get that 100 point process kicked off? It sounds as if it's automated. I'm giving it food to chew and it's
Mhm.
doing its work
Mhm.
afterward, right?
So the
So kind
checklist
of talk me through the
The
onboard,
audit
the
is
intake or
actually a
whatever.
checklist. So you can't really automate it because you've got to pull down files and you've got to audit what's going on. It would be lovely if it was, but there's really no way to automate did everybody collect data correctly. right?
Right.
But what you could do once you've done it one time is probably set up, I could help you set up a process to automate it for the next time. Once I see
Well,
what
there
you
you go.
your
That
data
that's
source
a
is worth.
that's a segue I
Mhm,
hadn't intended, but I
mhm,
do like you mentioning that,
mhm,
and that is part of what ROI that works. Part of your company, part of your offering, part of that. Hey, I've been there. I know your pain type of thing.
mhm.
Is you do make yourself available.
Absolutely.
Not just, you don't make just the what I'd call the SaaS part available, which you do. There is a
Right.
component that says, "Hey, you can engage with me. You can reach out, whether it be through a training, webinar, workshop, one-on-one." There's an engagement aspect here as well, where they can reach out and
Mhm.
engage with you, for different fee levels in terms of the amount of effort and the amount of engagement they need from you, right? It's not
Right.
just this faceless corporate entity where they just throw a problem against the wall and pray for a solution. If they get stuck, there
Right.
are Mindy-based resources, resources available. Okay, that's good to know.
Absolutely.
And I do
Yep.
like that aspect. Yeah, I do like the
I will.
aspect you mentioned where, hey, maybe like on the first time for that audit, there may be a little bit more friction than there would be the second, third, and fourth times because once that foundation is laid for that process. The checklist is done, and now it is an engine. I think you used that term engine before. All of the things you are doing are meant to get the customer to the end state where at the end of every given month, they don't have to worry about that problem anymore or this problem anymore. Or, as they're going through those denials, they've got let's pretend for a minute
Mhm.
I'm just making up this number. There are I'm sure there are thousands, but let's say there are 18 different kinds of denials, and you've probably got there maybe is the top 20 that you see over and over and over again.
Right.
If I'm right about this, once they learn how to handle denial code 14, again, I'm making this up, 14, they don't necessarily have to go relearn how to solve 14 again. They may keep getting 14s from the insurance company or the whatever,
Mhm.
but they now know how to always handle a 14.
Right. Right.
And if
That's
they
actually a
forget,
pretty
they
good.
can come back and look,
Yeah, that's
right?
actually a pretty good segue because I can actually show you what something like that would look like if
Yeah,
that would.
take a minute if you
Yeah.
can certainly try since we are
S
video off
Yeah.
too,
So 14
you can
is a
certainly
real
try it.
code. It's not one that you see
Hey,
a
look at that.
lot, but let's just take it since you said it,
All right, let's try 14. I like it.
and what I'll
Totally
do.
unscripted, folks.
Yeah,
Totally
we're just gonna
yeah.
go. Let's just go off script. So let me show you kind of what that
Uh,
would look like, and I'll do a quick screen share. Give me 1 second here. So here we go. So this is the website, and again, it's very interactive. You can go pretty much anywhere here and get a lot of different help. But what I'll show you is the code that Kale mentioned, which is 14. It's not very common, but it's still going to give you some help if you do get it, because maybe you have problems with this because you've got some issues at front desk or whatever. So I'm kind of giving away what the problem is here. But you're going to go to your EDI Intelligence Lab. So this button is where you go. When you first go in, this is what that looks like. There are some common codes that are populated right here that you can click on if it's one you get a lot. But if it's not there, you could just hit lookup code by typing it in there. And then this is where it is. And what we've designed this to do is tell a full story about what the problem is. So the first thing you're going to see here is the actual standardized description. So this is the description where if you got on the X12 website, so anybody who's in revenue cycle should know what that is. It's the ASC X12 website. This is the actual description of the code, the claim adjustment reason code or the CARC. This is what that's called. And then down here, and only I can edit this card, so disregard where it says edit. This is the admin view. And then down here, it's going to tell you kind of, you're going to give you an option to choose what group code you see on your EOB. So it's either a CO or a PI. Those are the only two you'll see with this claim adjustment code. And then down here, it's going to give you some information about what it means. So here's a key right here. This is a keying error on one of the dates of the wrong patient on the claim. Or it could be, maybe the insurance company has the wrong date of birth. So what you're looking at here is you've got a date of birth that follows the date of service. So there's something going on. either
Yeah,
the
so it's a human it's a typo, a
this
human
is
error perhaps
yes,
that
this is
is
likely a human
causing the
error. This is a data entry error. So this right here is something where if you were doing that master audit, this is something that you would find when you're doing that audit that your people are keying things in incorrectly. You have some data integrity issues, and data integrity is a big problem.
notice a root cause. I know
Mhm,
some of the things you were
mhm.
talking about
Yep,
before. I'm sort of echoing and
yeah,
reiterating
yep,
the value prop that you shared with us a moment ago in terms of it. You tell them the root cause.
right. So you
You
got your
mentioned
root
the action
causes,
plan,
gives you an action
right?
plan, appeal tips, and some prevention strategies. So this gives you more information about it. And if this was one that came with a lot of remark codes, those options would be down here. But again, this comes straight from that source. And then we also tie it back to CAQH puts out every year a core code combination list, which lists all of the CART codes and the RART codes that you can see them with so that you know what they'll be. So if you were to look at a different adjustment code, let's just say you were to look at 16, it it is always going to come with a RART code. If it doesn't, there's probably something in your EHR system where it's suppressing that field, and you would need to go in and actually work with your EHR to find out why that field is suppressed. So when you scroll down here, what you'll see is an option to complete that story. So what we're trying to do is tell a full story of what those adjustment codes mean. So if you go in here and you add your RART code, it's going to tell you the rest of the information about what it needs. So in this situation, the payer needs to understand if the diagnostic tests included on the claim were performed by the provider or purchased from another source. So all they're asking is, where did this test come from? Submit a corrected claim with that information. This is not an appeal. It's telling you very clearly this is not an appeal. This is a corrected claim. You need to let us know.
I want to ask you something here real quick. So what I'm hearing is, and I'm hearing you say it's not just you're throwing in for this is not like an FAQ. This is not a just a just a reference guide. This is literally, I like the word you use there, story. If I'm a revenue cycle professional and let's say I don't have this stuff burned into my brain like you do, this story, I need to know that second piece, which tells me in detail how, when I go back into the system and I resubmit that claim or
Mhm.
whatnot,
Right.
this is the piece of information I need to provide and why. Now, there and the reason I asked that question or call that out is because I've really got a couple of questions in terms of the what happens today
Mhm.
aspect and what the your customer in ROI would do next. And I'll start with that what happens today. And see and you and tell me if I'm off here. One of two things happens. They are under the gun. They need this revenue recognized. This person, she's sitting in a doctor's office somewhere under a bunch of UV light and she's having to put these back in and she resubmits and they come back rejected again and again and again because she doesn't know what she doesn't know. And so it may take her three, I say her, this may take this person three passes of a certain amount of effort to finally get that, quote, $57 thing paid.
Mhm.
Great. But she spent 10 person hours to do it, right? Okay. So that's problem one that you could solve by giving her the tools and the knowledge to frankly copy paste into her forms and to resubmit, right?
Right.
Uh, so from what you've explained to me in the past, today, what she does or folks that she will outsource to, they're leaning on brute force. They're leaning
Mhm.
on some guesswork. They're leaning
Yeah.
on fill in the blank.
Yeah.
Try this, try that, try the other thing. So whether they're paying a person in their office to do it or they're paying a group
Mhm.
of resources offshore to do it, the the pain seems to be the same. There's this
Mhm.
loop they go
Right.
through because they don't know precisely what to put in. Am
Right.
I correct in that?
You're pretty correct. Yeah. So a lot of times what'll happen is, and I kind of alluded to it early on about a lot of systems will suppress that remark code or it's difficult to get to that remark code. And that's this piece that's down here. And there are going to be certain codes, certain denial codes that are not specific enough to give you the full details of what's missing. So in this particular case, I'm looking at CARC 50. So it'll most of the time come on your EOB or your 835 as a CO 50. So CO means it's a contractual obligation, and that means if you can't get the money for it, you have to adjust it. You can't bill the patient for it. And so that's why these group codes are important. You have to pay really close attention to them. That you can't just disregard them and you can't just assume everything is a CO because everything's not. So these are important too. But when we're looking at this 50, for example, it should have a remark code. And if you're working in a system where that remark code is suppressed, you're not going to know why it's not deemed a medical necessity. So you're going to be going, you're going to be chasing your tail trying to figure out why. Why do they think it's not a medical necessity? And you're going to be submitting documentation saying it's a medical necessity because, but you don't have
and they're guessing.
information to fall back on. But if you go back to the remark code, it's going to say, you know, there's something that's missing. So let's just say, okay, let's just say the remark code was actually this 60. It's missing a certificate of medical necessity. There was something that needed to be submitted with the claim that wasn't there. And perhaps there's a certificate of medical necessity on file that you could submit with the appeal that would stop that appeal in its tracks so that the minute you submitted it, you're like, yes, here it is, pay this claim. Or there was um, there was something that was missing, like missing here's this one is missing incomplete invalid procedure code. So there was a procedure code on there that was incorrect or something didn't match up. So if you can see those remark codes, those are a big deal. So if you're dealing with a system where you can't see those, you have to work on why they're being suppressed, or you have to pull that raw 835 and try to find it.
Okay, or in this case, the better or is you don't fight the system. This
Yeah.
is the Gen X in us here. You
Yeah.
don't fight the system. You don't go scrambling to another
Hmm.
place to
Hmm.
find that remark code. You come to ROIthatworks.com.
Hmm.
Mindy has done all that
Yep.
science and all that
Yep.
investigation, all that analysis, and she's built this database. She's built this engine that constantly is
Hmm.
updated. And then by constantly, correct me, I think it's weekly or monthly. This is refreshed so that even though some of these things
Hmm.
don't change very often, when one of your customers comes in and they need that RARC, it's
Uh-huh.
there and it's
Yeah.
current
Yeah.
and they
Well,
can
you'll need to
copy
be able to
paste.
find the RARC on the EOB to know what it is. But then I'll have the information for you here.
You don't
They
need to
have to
dive too
provide
much
it. Yeah.
there. Right.
But sometimes you
But the
can't
idea
find
is
it.
they don't have to
Mhm.
they can get past that suppression scenario that you alluded to a couple of times, for example.
They
They
would
can they
still
this
need to
is a
have it
means.
unsuppressed. No, because I won't be able to tell them what their RARC is. So I want to back
Okay.
up there.
So
I will be able to tell
yeah.
them what it means, but I
Okay,
won't be able
but
to find it for
that's
them.
a good distinction. So we're
Yeah.
not providing them a magic wand. We're providing them
Hmm.
a means to have the full picture once they've
Yes.
gotten past that barrier.
Yes.
That's a good distinction.
What I'm
What I want to
telling
do, I want
them
to kind of
Yes, what I'm showing them
yeah,
here is this should have one. If you don't have one, your system is the issue. Find out
gotcha,
why your
and
system
that
is
tells them
suppressing
where to
that.
go back and look.
Yeah.
Okay,
Yes.
let me do this.
Uh,
Let me so we don't do spoilers. Let me do this. Let me kind of help have you bring it home for us in terms of we've talked about why you did this, what this is at a high level and what it's meant to do in terms of helping the folks like you that spent all those hours for all those years. This is your way of making the world a better place. So maybe bring it home for the folks who are still with us here this first episode. Tell us why it's so important to you as Mindy the human. Let's pivot off of the tool and let's focus back on you to bring it home. Why is this so important to you?
for me, some of the biggest issues I ran into again were not knowing what the payers were trying to tell us and having teams that were not always telling me 100% true stories. They were burying things underneath piles of other stuff where it was difficult to get to. Dealing with those reports at month end and just in general, just frustrating day in, day out slog trying to solve problems and trying to prevent leakage and trying to decrease things like days in AR denial rates and not having the resources to do it. And
What did that do to Mindy the person is what I was
that what
asking.
that I'm getting to
I'm
that. Yeah.
yeah,
When
yeah.
dealing with that every single day got to the point where I couldn't handle it anymore. It was too much. It was overwhelming. It was frustrating. And I kept looking at it going, there has to be a better way. It can't always be like this. And it shouldn't have to be this hard. And if no one else is going to build it, then I will, because this is what we need. We need tools, we need resources, and we need them all to be in the same place. We shouldn't have to go to 15 different websites to find answers. And we shouldn't have to fight with tech support at ECW or Epic or any of those places to get our raw data that is ours, that belongs to us as the practice. We shouldn't have to fight to get that. That should belong to us, and we should be able to get it anytime we
There.
want it.
Yeah.
And
Yeah.
so I just decided that I can't handle it anymore. And I know that there are hundreds, thousands of people out there dealing with this same garbage every day that can't deal with it anymore either. So I wanted to build something for me and for you that said, screw it. We're not dealing with that garbage anymore.
Right.
Let's make it easy, because revenue cycle should not be that hard. And
It
bringing money
shouldn't
in
be
the
that hard
door
to
should
get what you're
not be
owed.
that hard.
Right. And listen, I think also too, not to speak for you, but I think, you've got some professional and personal relationships with providers over the years as human beings. And you've seen these professional men and women as doctors, as physicians, and, healthcare providers of all stripes, where they are at their wits' end. They're fried. Everything they submit gets chopped down by the insurance company or by Medicare, Medicaid, Meta, whoever, and then they get denied the whole thing.
Right,
They've got to feed their families with the 80 hours they spend per week, 15 minutes a shot talking to patients.
right,
You're like, hey, something has to give for them as well. It's not just the person sitting in the office with the UV lights, it's the provider. It goes to the heart of the practice,
right.
right? So that's why you mentioned toward the middle of the conversation about how you want to make sure the entire practice information set is covered and represented. It's that human aspect across the board. I think the last thing I'll ask you to sort of wrap up with here is the just again I want to focus on the human aspect, the ROI that works and all that. Of course, there's an AI component. There's a lot of knowledge and things behind the scenes to help you provide those answers to those people that need them in those use cases and those scenarios. But at the end of the day, it's that human element that you were sharing. I think that I want you to reiterate as we close about the tool itself, about how as I'm going through it and I'm using it, the user is front and foremost in your mind.
Mhm.
And I may be saying too much, I may be saying all your words, but I just talk about how this isn't just an encyclopedia, it's not just a wrapper on AI. This is human based and it's human focused. How and why?
I mean, it's designed to, yeah, exactly. You did pretty much use my words. It's designed for the human. It's here to be used by the person who needs it. It's not out there to just run your data and spit out reports. Yeah, we can do that. If you want the automation modules, we absolutely can do that. But they're all interactive. Everything is here and designed for hands-on, for users to learn. And I'm not telling you you have to do it my way. I'm giving you tools so that you can automate and create your workflows the way they work for you. And they're tools, and they're here to be used by humans.
And you've got control in every
Mhm,
step of the
mhm.
way
Yep,
until it's
mhm.
submitted a quote out the
Yep,
door into the next
yep,
system by that person using it. So
yes.
it's not automated where she or he lose control of the thing and
Mhm.
it gets sent to the
Right,
EHR
right.
without their permission,
Exactly.
right? The human is the gate.
The human is always the
He or
gate.
she is the
Mhm.
central actor in the whole thing,
Yep.
right? And
Yes.
I wanted folks to end knowing that not only is there a human behind it and somewhat a bit about you, the human, but then why you made it the way you did and how it came out. So again, last word for you. If anything else you want to say about you or your product or how folks can find out more, let's leave them that.
So just a few things. So my goal with all of this is to reduce friction. So anything to make life easier for you, That's what this is here for. Unlike all of those other systems that are out there, I am available for questions. I'm here if you need help. I'm not just going to throw you a subscription and say, leave me alone. My contact information is on the website. You can reach me if you need anything. I'm not just throwing it at you. If you have questions, I'm here to help. So please do reach out. Third, what we'll do is we'll put links in the show notes. So anything that you need to access, we'll put links there. When you sign up, you just go in, you sign up, you enter your information, and you get your access, and you can access the system as soon as you've done that. If you want anything with automation, contact me. We'll have to work out licensing and the BAA and all the HIPAA stuff. But otherwise,
Gotcha.
there's no PHI if you're just using the website portion. So you sign
That's
up,
key
you
to
get
know.
in, and it's yours to use.
So the typical journey for the person using it, the most use cases, the onboarding is minimal. The friction is it's you want that person to spend 2-3 minutes getting going, and then they're ready to
Yep.
roll,
Yep.
and they're solving the problem they came to find the solution for. They Googled and they found you, and they're crying,
Yep.
and
Yep.
they've had it right, and
Yep.
you're going to help them right then,
Right.
right? Yeah.
Exactly. And if
Okay.
there's anything you have issues
That's
with, questions about, email me.
Yeah. All right. Well, hey, this is going to sound funny talking to a woman who's sitting 10, 20 feet from me who happens to be my wife, but I do want to say thank you for doing the first episode with me. Episode two, for those who decide they want to come back and be assaulted again, we're going to flip the script a bit, and you're going to talk to me about me and where I am and why I do what I do, and how I came to be the professional strategy and operations guy that I am. Yeah. So, okay. Thank you very much.
Thank you, everybody.